Hello, my name is Torben Plesner. I'm a medical doctor, professor of hematology, working in Denmark at the Vejle Hospital. I'm associated with the University of Southern Denmark, and I've been here to tell about our results on Daratumumab in multiple myeloma. We have been studying the efficacy of a monoclonal antibody called Daratumumab, which is targeted against the CD38 protein, which is widely expressed in the human body, but very highly expressed in myeloma cells. We are building up our experience with this antibody. We presented at ASH and previously also at ASH at ASCO. And we have gained more and more experience, first with the single agent Daratumumab, and now with the combination of Daratumumab, lenalidomide, and dexamethasone. Our target population at this time point has been patients with relapsed and refractory multiple myeloma. We have experience from single agent Daratumumab and have found that the toxicity is really manageable. We see a little side infusion related reactions which are common to all monoclonal antibodies. This is not more difficult to use Daratumumab than other monoclonal antibodies that we are used to in the clinic for treatment of lymphoma, for instance. So we can easily manage the infusions. Now we have added on lenalidomide and dexamethasone, and the side effect profile we see more or less comes from the combination with lenalidomide. So it's mostly lenalidomide related side effects we see, and they are manageable and not unexpected. The big news are the responses that we see, because we see really activity with the single agent Daratumumab, but more so with the combination of Daratumumab and lenalidomide, where we see really extraordinary response rates. So I must say that the experience is quite new. We have patients that are out on more than 1 year of treatment with Daratumumab, lenalidomide, and dexamethasone, and we are building up more patients with this combination. We see extraordinary responses, including complete remissions. In the first cohort of patients that we have experience from with the treatment of Daratumumab, lenalidomide, and dexamethasone, we see a response rate with 12 out of 13 patients responding, which is, I think, quite remarkable. First of all, we need to build up more experience with the combination as it is in the phase 2 trial, but also very soon we will start on a randomized trial with lenalidomide and dexamethasone plus minus Daratumumab for relapsed and refractory multiple myeloma. We are looking very much forward to that, to study and demonstrate exactly the contribution of Daratumumab to lenalidomide and dexamethasone. And I think the next step after that would be to take it to the first line, because it's really well tolerated. I personally look very much forward to having this offered in the first line for the elderly population of myeloma patients, because those that are not candidates for high-dose therapy, they need something extra to be done. The great progress has been for the patients that are transplanted for myeloma. We need to do something extra for the elderly, which is 2/3 of the myeloma population. And since Daratumumab, lenalidomide, and dexamethasone, that's a very well-tolerated combination, I think we will see extraordinary results when we start treating elderly myeloma patients in the first line with the combination.